Okay, so let's continue with case number 27. A 25-year-old man is brought to the emergency department by an ambulance after a motor vehicle collision. He is lucid but has severe bleeding from his leg. His wife is with him and reports that the patient is generally healthy, although he had several bouts of lung and ear infections as a child. He also has a history of mild allergy and periodically suffers from diarrhea. In the emergency department, he is given 1 unit of type-matched red blood cells. Soon afterward, he develops a red, itchy rash over most of his body and begins to have difficulty breathing. His blood pressure drops despite continuous fluid infusion. What is the likely cause of this patient's repeated infections and allergic reaction to the blood transfusion? The patient is having an anaphylactic reaction. IgA is a common component in blood components. This patient likely has hereditary IgA deficiency and therefore has developed IgG antibodies against IgA. He is particularly susceptible to gastrointestinal infections, particularly giardiasis, for which secretory IgA plays an important protective role. IgA deficiency can occur as an isolated syndrome or may involve concurrent IgG deficiency, which increases the risk of sinopulmonary infections. What is the next step in management of this condition? Because of the patient's severe anaphylactic reaction to the transfused blood products, it is imperative to discontinue transfusion and administer epinephrine injection. Epinephrine counteracts the bronchospasm and vasodilation that is causing his respiratory difficulty and decreasing blood pressure. What is the cause of the patient's milk allergy? In the absence of intestinal IgA, large proteins are more likely to enter the bloodstream whole. An IgG antibody reaction to these proteins can then cause an allergic reaction. This is different from lactose intolerance, which is not a true allergy and involves a deficiency of lactase. For the same reasons, patients with IgG deficiency are at increased risk of developing antibodies against wheat proteins and thus celiac disease. What are the stages in B-cell development that leads up to IgA secretion? Pluripotent stem cells first differentiate into lymphoid stem cells, then to pro-B cells, then to pre-B cells. Pre-B cells contain the IgM or mu heavy chains intracellularly, but no surface IgM. The next step is formation of immature or naive B cells that express surface IgM. After stimulation by antigen, the immature cells can mature into IgM secreting cells, or with CD4 plus T cell stimulation, which is CD4 ligand to CD40 receptor activation, they can class switch to express IgG, IgA, or IgE antibodies. After switching, the cells can undergo affinity maturation to select for antibodies with higher binding affinities for the antigen, and subsequently form plasma cells that secrete these specialized antibodies.